Laura, thanks again for being here with us and for the partnership with the American Hospital Association and the nation's hospitals. As you know, and as I've been stating for quite some time, to anyone who will listen, government, policymakers, and up on the Hill, the attacks against America's hospitals, cyber attacks, specifically ransomware attacks, have increased exponentially over the last several years, really resulting in widespread disruption and delay to healthcare delivery, ultimately risking patient safety, not only for our patients in the hospital, but to the entire community served by them. And one of the areas that we're most concerned about is our rural hospitals. They don't have easily available diversion points. They may be less resourced to withstand these attacks. And we've had those discussions with the White House, directly with the National Security Council, and as they think about pending legislation or regulation targeting hospitals, we explain our concerns, we talk about the resource gap, and I'm often advised by the government there's no money. So another unfunded mandate, which is very difficult for a hospital to achieve.
Of course.
So one of the things that, I've suggested directly to the White House was that why don't we approach the private sector, our good partners like Microsoft and others, to help see if they can fill that resource gap. And we were so pleased that Microsoft readily responded, and we talked about, help develop this plan where nonprofit pricing that's applied in other sectors would be applied to rural hospitals. Can you tell us a little bit about that program?
Yeah, I'd be delighted to do so. And you're right. The cyber attacks in healthcare are devastating, but they're particularly profound and impactful in rural healthcare. Patient access obviously is impacted financially. It can be almost devastating, if not devastating, particularly when you think about diversions and reduction in admissions and days in AR and all of those factors that hospitals weigh day in and day out to stay afloat. And it's also reputational, right, for those hospitals. They report their data breaches. I had a CEO, and back in my consulting days, say to me, I do not want to be on the front page of the local newspaper because of a cyber attack. So you figure it out, right? I mean, they're worried. So Microsoft was honored to receive the call from the AHA and the White House to work collaboratively to create this program. And what we call it the Cybersecurity program for rural hospitals. And, we look not only at what we need in terms of software solutions, but also what we could do to help those rural hospitals even understand their points of vulnerability, to train their staff, and to really fortify their whole presence immediately and for the long term. So the program itself has, I consider it 3 pillars. The first is the cybersecurity assessment itself. And what we've done is we've partnered with trusted security consulting firms to tailor a cybersecurity assessment that looks broadly at the ecosystem of the rural hospital, but also looks and anchors itself in the emerging performance goals we're anticipating HHS to publish. And the reason we did that is we want to help those hospitals think about the future, right? Understand where they're at today, but also think about the future. That assessment really becomes the foundation then of what they need in terms of training, in terms of services and solutions. So I think that's a really valuable piece. We mentioned the training, and what we've done is we've actually set back and curated training for frontline staff and sort of initial certification for IT staff. Again, this is all to help them better understand and prepare for and respond to any cyber risks that present in their environment. And the third piece, which I think is really important, and is what Microsoft has done, others have done to really step up and support these rural hospitals in affordable access to security software. I have spent a good portion of my career working in what I call safety net organizations, really those organizations, rural hospitals, health centers that serve the underserved. And it feels like a really profound movement on Microsoft to further its investment in rural America by making critical access hospitals and rural emergency hospitals eligible for nonprofit pricing. What this does is, in many cases, lowers the price point for these security solutions and other software solutions by 60 to 75%, which is really significant for these hospitals that live on razor-thin margins. For larger health systems and for larger hospitals, we're also providing our enterprise E5 solution. It's kind of the standard enterprise software package, free for a year. Also recognizing that rural hospitals often have older technology, we're offering a 1-year extension of our Windows 10 service pack when it becomes available. And so we've done a lot to really make the solutions supporting and enabling cybersecurity to be more accessible to all rural hospitals.
And we really appreciate the approach. As you know, we're involved in a lot of these policy discussions with the White House and HHS, and we help develop these voluntary cybersecurity performance goals. So, and we always say to our members in the media, we support cybersecurity performance goals, voluntary cybersecurity performance goals. And the issue is in terms of hospitals which may not be implementing them, is we always say it's not a matter of will, it's a matter of resources.
Yes.
There isn't a hospital executive that I speak to, large or small, anywhere in this country, that does not prioritize cybersecurity. So in my discussions with policymakers, I said, let's really understand, if they're not implementing, what is the barrier to implementation? It's resources.
Yep.
So when you all came out and said, we're willing to do this in significant discounts, and we'll continue to work with you, Laura, to see how we can expand the program and include more, but we appreciate your initial effort. I think it's substantial. Small hospitals often have to decide between the latest cybersecurity tool or a new MRI to serve their community. And we shouldn't make it that hard. So your approach, I think, is the right approach. Let's assess. Let's not just throw things at them. What do they need? What do they really need to effectively defend against these attacks, be better prepared to respond? And as I always say to the government as well, we want to do our part. But hospitals are not cybersecurity companies. We've
Right.
got to rely on the technical professionals. And ultimately, this really needs is a whole-of-nation approach. Hospitals alone can't do this. We need everyone in healthcare to join. We need good technology partners such as Microsoft to help us. So ultimately, we all know everybody in this country depends on a hospital. Hopefully you're not in the hospital, but we depend on its availability should we suddenly need one. So we appreciate what you're doing. Tell us where we are on the status of the program now, and how do we sign up for your services?
Yeah, we're just delighted in the interest in the program. In the first month alone, since the AHA and the White House and Microsoft and others announced this, we had over 300 hospitals sign up, which is terrific. Our goal, honestly, is to have every hospital in the nation secure.
And we would appreciate that's our goal as well.
Right? And so, we want to support as many hospitals as we can. And so if that's through the solution discounts, if it's through the assessments or the training, the more we can work together on this, the better. So if any hospitals are interested, obviously our website, and you can also email the program directly. I think we made this sort of very high touch for hospitals. They don't want to get lost in the big sort of maze of a large organization. So you can email the program directly at mrhtp@microsoft.com. We have a team that's working together to support the program and ultimately the rural hospitals.
Great. Thank you so much, Laura. We appreciate your dedicated focus on the program. As you know, some may say, well, Microsoft is so big, this is an announcement, will they follow through? I know you'll follow through. We'll be watching to make sure you follow through to help. Again, thank you for your partnership and all you're doing to help defend hospitals in America.
Thank you, John. It's a pleasure to be here.